Ronell Nolan, President, CEO, Health Agents for America, coming to you live this Monday. I am calling all ninja warriors to the front line. You don't have to have a certain skill set. I just need you. I can't do this alone. I feel like we are being hit by every side possible. Medicare, ACA, insurance companies, the hurricanes, our folks being without. It's really almost too much. So I'm going to ask for your help, and I hope that you're willing to give it. I wanted to talk to you about the article you've probably read about Medicare, United Healthcare suing Medicare over their degrading ratings. Things are just happening. Things are happening all over. And then I wanted to talk about, of course, the WellCare, not paying commissions, so many people not paying commissions, definitely something that we're still trying to fight, trying to get some attention. CMS on the Medicare side seems to have gone down a rabbit hole and are hiding, so to find someone to answer questions is impossible. We understand we can't charge fees. That might be something that we can do next year, but at this point I'm not sure if it's a state regulation or if it's a federal regulation. And if I have to go to Washington and knock on every door and find out that Medicare person, CMS, that's willing to give me 10 minutes and help us with some direction, that would be simply amazing. So that's definitely on our radar. We've had a lot of talk about the Inflation Reduction Act and the $2,000 max, which is affecting the credible coverage on employers. I have read and read and read, and I have reached out to Capitol Hill, and you would think that no one really understands or knows what this is. If you are in the employer market, by October 15th, your employer needs to notify your employees over 65 whether their coverage is credible. We do have instructions on the HAFA website under the resource library, which of course is password protected for members only. I encourage you to use that, make it your own. But that needs to happen, and that's going to happen in 8 days. So very, very, very soon. What I have not found, and it is very confusing, is when that senior needs to enroll in B and D. What I'm reading over and over and over is that they need to go ahead and enroll, that the employer should have notified the employee way before October 15th so they were ready for open enrollment Medicare. So that's what I'm reading. Until I find something different, that's what I know. As far as those that work in the Medicare field, you need to be partnering with those in the employer market to enroll those folks in Part B and D so they are not penalized. A few things I pulled and I wanted to read to you. It says an employer-sponsored prescription drug plan is considered credible when the amount the plan pays is equal or greater than the standard prescription drug plan through Medicare. Important. While plan sponsors are not required to provide credible coverage, they are responsible for notifying Medicare eligible plan members on the status of their plan credibility. Employers must also disclose whether their coverage is credible to the Centers of Medicare and Medicaid CMS. Now, who helps? Is it the carriers? Is it TPAs? It is agents and brokers. There are formulas, methodologies on determining whether that coverage is credible. You just need to be prepared. You need to be prepared for open enrollment for employers, employees coming off of those employer plans until someone can show me in writing that there's some type of grace before the late charges start. I can't find it. It also says the employee takeaway: if the group plan is not considered credible, Medicare eligible employees will need to enroll in Part D separately or pay penalties. Doesn't say anything about any grace. If a Medicare eligibility employee transitions from group to Medicare, any dependents on the plan will need to seek alternative coverage. Important. Does that mean ACA? Does that mean, some type of COBRA coverage? You need to determine that. Depending on the specific situation, the dependent could either switch to coverage through their own employer if they're working, Medicare if they're over 65, or through an ACA plan. So not only do we have everything, consent, three-way calls, everything hitting us all at once, I am sincerely sorry for the things that are happening in our market. I know there are folks I see on Facebook say, "Oh, I think this is a good idea. I love this." Okay, I've been in the business since I was 18 years old, and I'm going to tell you, I do not love this. And I feel for you, and I want you to know if you need anything to let me know. Now, before we pass this section, if you have any comments, white papers that you would like me to include to our contacts in Washington, send that to me. If you do not know how to write a white paper, no problem. You send me your talking points and I will put it into a white paper. Rebecca Davis and Jennifer Pender have both sent some really good information that I have delivered to Washington. What I want to do is put a one-page target letter of these are the things that are affecting our industry and this is what we need help with ASAP in the next several weeks. So I need your help. I need you just to stop for a few minutes, and if you can't do it and you are blessed to have staff, ask your staff. Tell them, what you're thinking, let them jot them down, and just email to me. I need your help. You are the people on the front lines, and you know what's going on. Next, the ACA, I wanted to let you know that CMS is now going to have secret shoppers with network adequacy, finding out how long the wait times are. So we're not sure what that's going to look like, but I just wanted to let you know. I found out that on Friday. And then we all know and have talked about the payment notice that normally goes out in the middle of open enrollment. 276 pages that affects agents and brokers, and in 90% of the time, it's negatively. We do have an opportunity to comment. Our comments are due by 11/12. So they blessed us a little by issuing it before open enrollment of ACA. However, the comments are due in the middle of open enrollment, 11/12. Take a look. Tell me what you think. I need your comments. You can include your comments in HAFA, and you can write your own comments. Either way, but we need to have as many comments as possible. In the Monday Morning News, there's the full 276, and then there's some, headlines of some different things that are important. But please, please, please help me with this important subject. I have hired one of our past lobbyists to help with that also, but it's going to take an army. We all need to be together. The three-way calls, that's still going forward. I have not heard from Health Sherpa yet whether that they've got their system fixed or not. So that is still going forward. The 12-hour reintegration still going forward. You can still use the NPN override as long as your state does not require that you have a direct contract with your insurance companies, such as Louisiana. We do not have to have a direct contract. I can work through another agent as long as I have my own NPN and I'm licensed. I can use their contract. So very important for those that are asking those questions. I hope that you are listening to the Monday Morning News. It's important that you know what's going on. It's important that you can help me so we can survive this crazy, crazy world. The Summit Hotel registration link is open. So please go ahead and book your rooms. They're gonna go fast. And I wanna make sure if I need to add more rooms that I can. Some folks asked to stay through Saturday, so I have asked them to extend. And I'm gonna tell you that rate is unheard of in the French Quarter. So I'm asking if they'll extend it for that Saturday. So if I get it, you wanna book it because it's gonna be the first come, first serve, and there's not gonna be that many. So definitely book that. Your registration prices will be coming very soon as I calculate everything it's gonna cost to get us where we need to be and have a lot of fun and enjoy our time. So please call me if you need me. Please take a look at those few things. Please email me. Please help me. I am one person, and while I have crazy ideas and I will fight like hell for you, but you are the boots on the ground. You know what's happening. You know how we're affected. You know what you need, and I need you. Have a wonderful week. Lots of love. See you soon.